Welcome to Tuesday Tips. My name is Sharon Johnson. I am with Train 51, and today's topic is front desk pre-visit planning. Front desk pre-visit planning is a powerful tool to use. Performing pre-visit planning at your practice is an opportunity and a surefire way to save time and reduce unpreparedness, data inaccuracy, and costs. Planning leads to a meaningful and productive office visit as much as possible. So let's take a look at some practical ways in how we can tailor our pre-visit planning in our practices. And as a reminder, each physician practice is different in size, scope, tool, and resources. And so I recommend that you would look at your front desk pre-visit planning workflow that best suits your practice. So let's dive in. First, it is essential to review your patient appointment schedule list in advance. You want to do this at least 3 days in advance. You should prepare your schedule list on a weekly basis, and you want to review any patient information that may be a year or so old or even just a few months, because you want to ensure that you're updating insurance payer coverage plans, and also demographic information. Patient open enrollment happens throughout the year with their job. And if you recall, October and December 5th through December 15th is Medicare open enrollment. So your Medicare beneficiaries are looking to change their insurance plan, what coverage they have. So I would say make sure that you are identifying these changes as your patients are scheduled on your list. The second is you want to also identify any copays, or if necessary, of course, if that's applicable. And you also want to identify any patient balance bill or collection payment arrangements that you've made in a prior appointment or a prior procedure. Third, depending on the type of EMR that you have, will determine where you're going to enter that information and where it's going to reside, so that it will be easier for your front desk to view. And when the patient checks in, they already have it readily available. They can communicate what is necessary for the patient to do at the front desk, and they're ready and prepared. And just in case if there's a patient unexpectedly that comes up and arrives, then there's quick action that they can do because their list is already prepared for that day or for that week. The third is that the benefit of front desk check-in pre-planning is that it reduces wait time at check-in, and also because it's already prepared, the patient can just check in and have the conversation with the front desk person, and they can collect all that information if necessary. Again, for copays, that is required. If there's no copays required, then the patient does not have to give anything to the front desk. The other is also leveraging your patient portal. If you're able to do an e-check-in in registration, again, updating your insurance information and insurance coverage in advance. If you also utilize text messaging in your patient portal, I would encourage you to do that. It depends on the type of setting that you have. And again, it depends on the type of electronic medical record that you have utilizing patient portal. And so key would be an e-check-in. If you have that feature enabled, they're able to check in advance. They can probably also update their status that they are in the practice and have checked in. And so that just eliminates any lengthy wait time as the patient checks in. Fourth, I would say that the data accuracy and the information gathered in advance is very helpful, because it will also submit a clean claim, and that it will prevent from further delays that you may have when you're submitting your charge. It's also going to be beneficial in timeliness in getting reimbursement. And so when you have delays and you have denials and you have to resubmit your claims, it just, costs you a little bit of not only time, but in your cash flow because of those delays. And lastly, I recommend that you would have an annual training and also an audit on your front desk process to see if, are we up to date? Is there anything that in the front desk process that we need to tweak or adjust? Is there any training that for our front desk staff to strengthen their skill set in this area? And lastly, the audit just allows you to make sure that, all the insurance coverage has been checked, the demographics have been up to date. Again, I go back to patients' insurance coverage changes, especially if they're working. Open enrollment happens depending on their annual date, whether that's fiscal or calendar year. And also during this time, between October 15 through December, Medicare changes happens when your Medicare beneficiaries are choosing what that would be in their Medicare coverage. So changes happen all year round. So it would be beneficial for you and your staff in the practice to make sure that that front desk process is and the skill set that you need for your front desk staff is up to date. As a reminder, physician practice site varies in size and scope, tool and resources. I suggest to optimize the front desk area that best suits your practice. Thank you for joining me in our Tuesday tips. I look forward to seeing you again in our next Tuesday tips. My name is Sharon Johnson with Train 51. Have a great day.